Your cat is spending a long time in the litter tray without passing anything more than a few drops of urine. Why can't my cat pee? What's the matter? And will it get better by itself? They may have had cystitis in the past, but is this just a repeat? Well, a blocked bladder might be the cause. And this is a true cat emergency. Hi, I'm Dr. Alex Avery from ourpetshealth.com, helping you and your pet to live a healthier, happier life. Now let me start by saying that if at this very minute you have a male cat who is currently struggling or straining to pee, and if he appears in any form of discomfort, pain or distress, or is any way unwell, you should stop listening to this, you should stop watching this video and contact your vet straight away. Untreated bladder obstruction kills quickly and rapid treatment is needed. Don't finish watching this video, call your vet, seriously. So for those of you still here, let me go into more detail. First of all, there are several things that can cause a cat to stop urinating. These include a simple cystitis, which can also be known as feline lower urinary tract disease and idiopathic cystitis, different names for the same condition. Bladder stones are another reason, bladder infection, bladder tumour, nerve damage, a damaged pelvis, tail or spinal damage, and finally a urethral obstruction or a blocked bladder. Cystitis in cats is by far the most common. Cystitis and bladder disease are discussed in a separate video, but right now, how can we tell if the bladder is blocked and that our cat is suffering a genuine emergency? Well, first of all, this is almost always a disease of male cats. This is because the urethra, the tube between the bladder and the outside world, is longer and more narrow in males compared to female cats. If your cat is a girl, then the chance of their bladder being blocked is much less. Of the other factors that increase the risk of your cat developing an obstruction, the first is obesity. Fat cats have been shown to be more likely to develop a blockage than healthy weight cats. A previous history of cystitis or obstruction is next. If your cat has had urinary issues in the past, even if they have never obstructed before, then they are at a greater risk. We know that once a cat has had cystitis, this is a condition that will need to be managed long term. So third is a cat fed a dry rather than a wet food diet. Cats are poor drinkers and so will have a very concentrated urine if they are fed dry food. This means that they need to empty their bladder less often. If there is any sludge, debris or crystals in the urine, they are more likely to build up in the bladder and so are more likely to cause an obstruction. A cat with a larger water intake though will have their bladder flushed out more regularly, reducing the risk of plug formation. A stress-prone cat in a stressful situation is our fourth risk factor. Stress is a big cause of cystitis. And this might be building work or renovations, it might be fireworks season, visitors to the house, a new baby, or even a new cat on the street. If you know that a stressful situation is coming up, then be extra vigilant and definitely speak to your vet if your cat has had bladder issues before. And last but not least is the fact that neutered and indoor-only cats are at a greater risk. Most likely because these factors make obesity more likely. So your cat may tick a few of these risk factors, though not every cat reads the textbook. What symptoms then might they be showing that means a bladder obstruction could be developing? Well, very often there'll be a build-up of a few days where your cat may appear a little uncomfortable, they may not eat or drink as well as normal, you might just feel that they are a bit off. Sometimes though there will be no warning, they go from normal to emergency in the blink of an eye. If you notice any of the following, then a trip to your vet should be arranged straight away. Frequent trips to the litter tray, spending more time squatting without producing any urine, red tinged urine, especially if only producing a small amount, crying or vocalizing, especially when urinating or squatting, increased agitation and restlessness, they might be licking their back end frequently, and lastly, pain when picked up under their abdomen. As the disease progresses, your cat may then start to vomit, they may collapse, they may become comatose, and ultimately they will die without treatment. When you take your cat to the vet, if an obstruction is confirmed, several things will happen. They will need to be hospitalised and the blockage will be cleared by passing a urinary catheter under either heavy sedation or anaesthetic. An X-ray may be taken to see if there is any clear underlying problem, and blood testing run to check the kidneys and general body health. The bladder will then be flushed to remove any debris and the catheter will likely be stitched in place while your cat recovers. Intravenous fluids are also essential to support your cat's recovery. Typically after a day or two, the bladder catheter will then be removed and your cat will be discharged on several different medications and management strategies to try and prevent the risk of the blockage recurring. Now this is really important because we know that within 24 hours, 10% of cats will re-obstruct, and this increases to 20% after 30 days. 1 in 4 cats suffer a repeat bladder obstruction within 2 years. There are though some medical strategies to treat these cats without catheterisation, but they are definitely suboptimal and carry a higher risk of death. Also, in some instances when either the obstruction can't be cleared or an individual suffers from multiple episodes of reobstruction, an operation known as a perennial urethrostomy may be recommended. This involves removal of the penis, which is where the urethra is at its most narrow, creating a new hole for the cat to urinate through. Environmental management, medication and dietary changes can all reduce the risk of a repeat problem occurring, and they're discussed in a separate video. So I hope this video helps your cat get the treatment it needs or kickstart some strategies such as weight loss to prevent it in the first place. If you have any questions or if you'd like to share any stories, then I'd love to read them down in the comments below. Also, if it's your first time here, consider subscribing and hitting the bell notification to make sure you don't miss out on future content and allow me to continue to help you and your pet to live a healthier, happier life. So until next time, I'm Dr. Alex from Our Pets Health, because they're family.